My topic is sickle cell disease. In the definition, we have the sickle cell disease is a group of blood disorders typically inherited from a person's parents. The most common type is known as sickle cell anemia. It results in abnormality in the oxygen-carrying protein hemoglobin found in red blood cells. This leads to a rigid cycle lived under certain circumstances. Problems in sickle cell disease typically begin around 5 to 6 months of age. A number of health problems may develop, such as attacks of pains, anemia, swelling of the hands and feet, bacterial infections, and stroke. Long-term pain may develop as people get older. In the application in medicine, we need to know that it occurs when a person inherits two abnormal copies of the hemoglobin gene, one from each parent. This gene occurs in chromosome 11. Several subtypes exist depending on the exact mutation in each hemoglobin gene. An attack can be set off by temperature change, stress, dehydration, and high altitude. A person with a single abnormal copy does not usually have symptoms and is said to have sickle cell trait. Such people are also referred to as carriers. Diagnosis is by a blood test, and some countries test all babies at birth for the disease. Diagnosis is also possible during pregnancy. In the pros and cons, we have this video. In the pros, we have the care of people with sickle cell disease may include infection, prevention with vaccination, and antibiotics, high fluid intake, folic acid supplementation, and pain medication. Other measures may include blood transfusion and the medication hydroxycarbamide. A small percentage of people can be cured by a transplant of bone marrow cells. In the cons, we have the aplastic crisis are acute worsening of the patient battling anemia, producing pale appearance, fast heart rate, and fatigue. This crisis is normally triggered by parvovirus B, which directly affects production of red blood cells by embedding the red cells precursors and multiplying and destroying them. Parvovirus infection almost completely prevents red blood cells production for 2 or 3 days. In normal individuals, this is of the little consequence. By the shortened red cells life of the CD patient results in abrupt, life-threatening insultation. Reticulocyte count drop dramatically during the disease, and the rapid runoff of the red cells leads to a drop in the hemoglobin. This crisis takes 4 days to 1 week to disappear. Most patients can be managed supportively, some need blood transfusion. The initial play in Ecuador we have that it helps us to identify the signs and the symptoms of the sickle cell disease are caused by the sickle of the red blood cells. When red blood cells cycles, they break down prematurely, which can lead to anemia. Anemia can cause shortness of breath, fatigue, and delayed growth and development in children. The rapid breakdown of the red blood cells may also cause yellowing of the eyes and skin, which are signs of jaundice. In the conclusion, we have that the awful sickle cell anemia is usually diagnosed in infancy. If you or your child develop any of the following problems, see your doctor right away or seek emergency medical care. Unexplained episodes of severe pain such as pain in the abdomen, chest, bones or joints, swelling in the hearts of feet, abdominal swelling, especially in the areas tender of the touch, fever. People with sickle cell anemia have an increased risk of infection, and fever can be the first signs of infection. Pale skin or nail beds, yellow tint to the skin or white eyes of the eyes. Thank you.